Peripheral neuropathy does something that very few other conditions do. It can take a nerve that is no longer functioning properly and turn it into a source of pain at the same time. The very nerve that fails to accurately tell your brain where your foot is on the ground may also be sending signals that feel like burning, tingling, numbness, or electric shocks. This is not a simple malfunction. It is a nerve caught between underperforming and overreacting, both occurring within the same tissue at the same time. Understanding this is the first step toward understanding why targeted movement, when applied correctly, can often achieve results that medication alone cannot. Peripheral neuropathy affecting the feet and legs impacts tens of millions of adults over the age of 60. Most people manage it using one of two approaches: medication that dulls symptoms without addressing the underlying nerve dysfunction, or rest based on the belief that reducing demands on damaged tissue will help it recover. Both approaches have value, but neither directly addresses the core biological issue. Damaged peripheral nerves need adequate blood flow, oxygen, nerve stimulation, and mechanical loading if they are to recover or experience meaningful symptom improvement. My name is Dr. Favor Admi, and this channel is dedicated to bringing you the latest research on senior health in a simple, practical format you can use in everyday life. If you have not subscribed yet, please do so and stay updated with our latest content. Today, I will show you 5 exercises that can help reduce neuropathy symptoms in your feet and legs. I will explain exactly how each exercise works at the nerve level and reveal the single most important factor in performing them correctly, something many people get wrong. Stay with me until the end, because the 5th exercise has been identified by researchers as having one of the greatest combined benefits for symptom relief and fall prevention, yet most people have never tried it. Before we discuss the exercises, it is important to understand what is happening inside your nerves. When you understand the biology behind neuropathy, you are far more likely to perform these exercises consistently and effectively, rather than viewing them as simple stretches. Peripheral nerves, the nerves that extend from your spinal cord all the way to your feet, are living tissues with their own blood supply. They are nourished by tiny blood vessels called vasa nervorum, which deliver the oxygen and nutrients nerves need to function properly and maintain their protective covering. Think of this covering as the insulation around an electrical wire. Healthy insulation allows signals to travel accurately and efficiently. Damaged insulation, however, can distort those signals, causing sensations such as burning, tingling, numbness, and pain. In peripheral neuropathy, the blood supply to the nerves has often been compromised over many years. Common causes include diabetes, chronic inflammation, poor circulation, and vitamin deficiencies. As a result, nerves may not receive the nutrients they need. They begin to misfire, become overly sensitive to light touch, and fail to provide the accurate position information required for balance and coordination. What many people are never told is that research suggests regular, targeted exercise can improve blood flow to peripheral nerves, support nerve signaling, help preserve existing nerve function, and may even encourage some degree of nerve repair. Exercise does more than manage symptoms. It can help improve the environment in which nerves function. The 5 exercises I'm about to share were selected because each targets a different but complementary aspect of nerve health, circulation, and functional recovery in the feet and legs. Exercise 1. Ankle circles. Sit comfortably in a chair with both feet flat on the floor. Lift one foot slightly off the ground and slowly rotate your ankle in a full circle 10 times clockwise. Then rotate it 10 times counterclockwise. Lower that foot and repeat the movement with the other ankle. Perform this exercise twice each day. Ankle circles do far more than simply loosen the joint. They directly improve circulation throughout the feet and ankles. With every rotation, the calf muscle pump is activated, helping move blood upward from the lower legs toward the heart, while drawing fresh, oxygen-rich blood back into the feet. This process is especially important for the vasa nervorum, the tiny blood vessels responsible for nourishing peripheral nerves. The more consistently blood flows through these vessels, the healthier the nerve environment becomes. What many people don't realize is that ankle circles also stimulate proprioception, the body's ability to sense position and movement. These are the same signals that damaged nerves often struggle to send accurately. Even gentle circular movements create valuable nerve activity that helps maintain communication pathways between the feet and the brain. In other words, you're not simply moving a joint. You're providing damaged nerves with repeated practice signals that help keep those pathways active. Exercise 2. Toe taps. Sit comfortably in a chair with both feet flat on the floor. Keep your heels planted and quickly lift your toes upward before tapping them back down. Continue at a steady pace for 20 to 30 seconds. Rest for 30 seconds and repeat the exercise 2 to 3 times. Toe taps activate both the muscles of the feet and the calves, increasing blood flow throughout the lower legs. At the same time, they generate rapid nerve signals through the soles of the feet and the muscles responsible for lifting the toes, areas commonly affected by peripheral neuropathy. Research suggests that repetitive foot movements can improve circulation while simultaneously enhancing nerve stimulation and sensory feedback. The steady tapping rhythm provides consistent sensory input to peripheral nerves, helping preserve nerve communication and improve signal accuracy over time. When practiced regularly, this simple movement can help maintain the connection between the feet and the nervous system while supporting healthier circulation. Exercise 3. Calf raises. Stand behind a sturdy chair and hold the backrest for balance and support. Slowly rise onto your toes as high as is comfortable. Hold the position for 2 seconds, then lower yourself back down with control. Perform 10 to 15 repetitions, rest briefly, and repeat for a second set. This is one of the most effective exercises for neuropathy, yet it is often underestimated. Calf raises provide two major benefits at the same time. First, they strongly activate the calf muscle pump, one of the body's most important mechanisms for returning blood from the lower legs back to the heart. As the calf muscles contract, they compress the deep veins and push blood upward. When the muscles relax, fresh blood flows back into the area. Few standing exercises provide such powerful circulatory stimulation. Second, the slow lowering phase challenges the proprioceptive nerves in the feet and ankles, the very pathways that neuropathy often damages. During the descent, nerves must continuously communicate information about balance and ankle position to the brain. Because these pathways are frequently impaired in neuropathy, practicing controlled calf raises helps reinforce and retrain them over time. Consistent repetition encourages stronger communication between the feet, legs, and nervous system. If you've made it this far, you're clearly serious about improving your health. Many people watch educational videos, learn something valuable, and then move on without taking action. If you're finding this information helpful, consider subscribing so you don't miss future content focused on healthy aging, mobility, and nerve health. One lesson I've learned after years of working with older adults is that meaningful progress rarely comes from extreme solutions. Instead, it comes from consistently doing the right small things day after day. Those daily habits are often what make the biggest difference in long-term health and quality of life. That is exactly why I created the 30-day blood pressure reset for seniors. It is a simple, step-by-step program designed to support healthy blood pressure through gentle daily habits, easy-to-follow exercises, and practical guidance that can be done right at home. The connection between blood pressure and neuropathy is more important than many people realize. High blood pressure and poor circulation are among the leading non-diabetic contributors to peripheral nerve damage. When blood pressure remains elevated for years, it can place stress on the tiny blood vessels that supply oxygen and nutrients to the nerves. Supporting healthy circulation helps create a better environment for nerve function and overall vascular health. Many of my patients and community members who have followed this structured approach have reported meaningful improvements in their daily routines. You'll see some of their feedback on your screen. A common theme among their experiences is feeling more confident, more in control of their health, and less overwhelmed by the day-to-day management of their condition. For most people, success did not come from making dramatic lifestyle changes. It came from following a clear, simple plan consistently. At the moment, I am opening enrollment to only a limited number of participants so I can provide more personalized support and follow-up. If you're interested, click the link in the description or scan the QR code to learn more. And if these videos have helped you better understand your health, You can also support this community through the link in the channel description. Your support allows us to continue creating straightforward, research-based health education. For adults over 60 who are often looking for practical answers they can actually use. Exercise 4. Seated foot stretches. Sit comfortably in a chair and cross one ankle over the opposite knee. Hold your foot with both hands and gently pull it upward toward your shin. Then slowly point your foot downward, away from your body. Hold each position for 3 to 5 seconds and repeat the movement 10 times on each foot. Perform this exercise once per day. This movement targets several important structures in the foot and ankle, including the plantar fascia, the tendons along the sole of the foot, and the nerves that travel around the outer portion of the ankle. These tissues are often affected early in lower extremity neuropathy. Gentle stretching improves flexibility in the connective tissue surrounding the nerves, helping reduce stiffness and easing mechanical pressure that can contribute to irritation and restricted circulation. Research has shown that foot and ankle mobility exercises can improve joint movement, increase blood flow, and prepare both muscles and nerves for more demanding activity. In many cases, performing stretching exercises before strengthening exercises produces better results than relying on either approach alone. Because this exercise is performed while seated, it carries very little risk and can be safely performed by individuals who struggle with balance or mobility challenges. It also serves as the perfect preparation for the fifth and most important exercise in this program. Exercise 5. Single leg balance holds. Stand behind a sturdy chair with both hands resting lightly on the backrest for support. Lift one foot a few inches off the floor and balance on the opposite leg. Hold the position for 10 seconds if possible. As your balance improves, gradually work toward 20 to 30 seconds. Lower your foot, rest briefly, and then repeat on the opposite side. Perform 2 to 3 rounds on each leg once per day. While this exercise may appear simple, it challenges the nervous system in a way few other movements can. Every second you spend balancing requires constant communication between your feet, ankles, legs, inner ear, and brain. Those continuous adjustments help strengthen the sensory pathways that neuropathy often weakens, making this one of the most effective exercises for improving stability, confidence, and fall prevention. Exercise 5. Single leg balance holds. This is the exercise with perhaps the greatest overall impact on both neuropathy symptoms and fall prevention. Yet it is also the one many people avoid because it feels challenging at first. What makes this exercise so powerful is the way it activates the nervous system. When you stand on one leg, every functioning proprioceptive nerve in the foot, ankle, and lower leg must work continuously. Your brain is constantly receiving information about pressure distribution, body position, ankle movement, and weight shifts in order to keep you balanced. Few exercises provide this level of nerve stimulation without requiring any special equipment. In many ways, single-leg balance training is direct rehabilitation for the nerve pathways themselves. It challenges the communication system between your feet and your brain, helping reinforce the very signals that neuropathy often weakens. Research has shown that sensory motor training, the category that includes balance exercises, can significantly improve balance, mobility, and functional performance in individuals with peripheral neuropathy. Studies have also found that regular physical activity may help preserve nerve function, support nerve repair processes, and reduce discomfort when practiced consistently over time. Start conservatively. Use both hands on a sturdy chair for support. As your confidence improves, progress to using one hand, then a fingertip, and eventually no support at all if it feels safe. Move at your own pace. There is no prize for rushing. Safety always comes first. The most important rule for success. Now here's the mistake that prevents many people from seeing results. Consistency matters far more than intensity. Your nervous system responds best to frequent, gentle stimulation. It does not need exhausting workouts or extreme effort. In fact, occasional intense sessions are often far less effective than short daily practice. Performing these exercises once a week is unlikely to create meaningful change. Performing them consistently every day can gradually improve circulation, strengthen nerve communication, enhance balance, and reduce symptom severity. The entire routine takes less than 20 minutes. Most of the exercises can be performed at home with little or no equipment. They should never be painful when done correctly and gently. What they do requires commitment. Your nerves have worked for you every day of your life. Even after years of damage, many continue doing their best to keep you moving, balanced, and independent. These exercises are one way to support them in return. A simple progression plan. If you're just getting started, keep it simple. Days 1 to 3. Ankle circles, toe taps days. 4 to 7. Add calf raises. Add seated foot stretches. Week 2 and beyond. Begin single leg balance holds. Gradually increase your hold time as your confidence improves. The nervous system responds best to gradual progression. Small improvements repeated consistently create lasting results. Before you go, I'd love to hear from you. Which of these 5 exercises will you start with today? And how long have you been dealing with neuropathy symptoms? Leave a comment below. I read every one, and your experiences help shape future videos. If you know someone struggling with burning, tingling, numbness, or discomfort in their feet, share this video with them. Many people believe medication is their only option, when in reality, movement and exercise can play an important role alongside appropriate medical care. Exercise is not a replacement for medical treatment, but for many people, it is the missing piece. A final thought. Many people spend years waiting for the perfect moment to focus on their health. Unfortunately, that perfect moment rarely arrives. That's one reason I created the 30-day blood pressure reset for seniors, a simple, structured program designed to help older adults build healthy daily habits without confusion or overwhelm. Inside, you'll find gentle daily exercises, practical lifestyle strategies, easy-to-follow routines, a clear step-by-step plan designed for long-term consistency. Many people who have followed the program report feeling more organized, more confident in their daily health habits, and more in control of their overall wellness. If you'd like to learn more, check the link in the description below. And if these videos have been helpful, consider supporting the channel. Your support helps us continue providing practical, research-based health education for adults over 60 who deserve clear, understandable guidance. Every bit of support helps us reach more people and continue building a community focused on healthier aging. I'm Dr. Favor Admai. Remember, your nerves are still working for you every day. Give them the support they need, stay consistent, and keep moving forward. I'll see you in the next video. Disclaimer. The information presented in this video is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. These exercises are generally appropriate for many adults living with peripheral neuropathy, but individual circumstances vary. Stop exercising and consult a healthcare professional if you experience sharp pain, worsening symptoms, dizziness, or any unexpected reaction. If you have severe balance difficulties, open foot wounds, significant circulation problems, or have recently undergone surgery involving your legs or feet, speak with your physician or physical therapist before beginning any new exercise program. Exercise can be an important part of neuropathy management, but it should be used alongside, not in place of, appropriate medical evaluation and treatment of the underlying cause.